Hi, my name is Dawn Abbott. This is a presentation on overtraining syndrome and trying to relate it to importance for the personal fitness trainer. So what is overtraining syndrome? In a nutshell, this is when a trained athlete is not showing improvement in their athletic performance anymore, but instead they're showing decline. Other words for this can be burnout or staleness. It can occur to a variety of different athletes: resistance-trained athletes, endurance-trained athletes. Studies have suggested that intense interval-trained athletes are actually the most likely to show overtraining syndrome. It can last for a variable period of time, meaning weeks to months, sometimes even years, and some athletes can't even recover from this syndrome. It's important for people to rule out other medical causes of these signs, as the signs of overtraining syndrome can mirror the signs of other medical causes as well. So the signs of overtraining syndrome can broadly be categorized into 4 different categories, including psychological, physiological, biochemical, and immunological. So psychological signs of overtraining syndrome can include mood change. Mood change is often the very first sign that's noticed, but it's such a broad sign that often it doesn't point towards overtraining syndrome. We can also see depression, fatigue, a decreased interest in training, and a loss of competitive drive, and sometimes even hostility. Physiologic signs of overtraining syndrome are quite varied, and I've just picked a few here. They can include decreased blood pressure, increased heart rate and respiratory rate, even at rest, and a decrease in body fat. Biochemical signs, again, there's so many that have been looked at, and these are just a very small portion. We can see increases in C-reactive protein, decreases in blood albumin, a decrease in muscle glycogen levels, rhabdomyolysis, low testosterone to cortisol ratio, and increases in the stress hormones such as cortisol. Immunological signs we can see can include nausea, headaches, fatigue, an increase in bacterial infections, and mostly we see upper respiratory infections. We can also see a cervical lymphadenopathy, which often goes with the upper respiratory infection. As for causes of overtraining syndrome, really overall, they're not known right now. There's only one agreed upon general cause right now, which is an increased training volume and intensity. Other possibilities may or may not include tissue trauma, a depletion of the muscle glycogen stores, excess of certain amino acids, and additional life stresses like work stresses, relationship stresses, things like that. Now, tissue trauma I thought was kind of an interesting one, as that's something that's normally seen with any athlete. You increase your training, you get tissue trauma that leads to a short-term inflammation, and then the body recovers. Here, what we're suggesting is that by constantly increasing the intensity, we're going to get some chronic inflammation that's going to lead to increases in harmful cytokines in the body, and that may be what causes overtraining syndrome. So can we predict overtraining syndrome? And right now the answer would be no, but a large field of study in overtraining syndrome is dedicated specifically to this topic, and the goal is to find an early marker for detection of this syndrome. It may or may not be one of the biochemical causes or biochemical signs that I discussed earlier. One example that a recent study has come out with is about psychomotor speed, which is suggested to be reduced in individuals who have overtraining syndrome. The problem is, decreased in psychomotor speed can be seen with other disorders as well, such as chronic fatigue syndrome. So there's no clear measurement parameters right now, and there's still a lot of study that has to be done. So really, prevention for overtraining syndrome is key, and this is where the personal fitness trainer can come into play, and I think needs to pay particular attention to this. It's important to kind of keep tabs on your client, know how your client's feeling before a workout, how they're feeling after a workout. It might be really useful to keep a record of the workouts that they're doing, the training, and their competition schedule to make sure that things are not being overdone. Make sure that your client has adequate rest between training, especially in intense training sessions, and provide a variety in their training schedule. Treatment of overtraining syndrome really comes down to rest, and this can be quite difficult. The rest is pretty strict rest and for quite a long period of time, from weeks to months and sometimes even more. An athlete can have a lot of trouble with this. They are a competitive person, they want to be involved with their sport, and rest is usually the last thing that they want to do. This can also be really difficult for the trainer or their coach to suggest to the athlete. If they're seeing a decrease in their performance, they're probably more likely to tell them to train more instead of telling them to rest. So it's important to keep in mind. Some studies have suggested that submaximal exercise with really small and slow increases in training can be okay, but this isn't proven, and again we go back to strict rest. So let's look at an example. So Jenny is a triathlete. She trains about 10 hours a week on average every week. In the last month, she's competed in 3 races: an Olympic distance triathlon, a half marathon, and a 5-kilometer time trial. She's only taken 3 rest days over the whole month. And over the last week, she's noticed the following symptoms. So when she's at rest, her heart rate and her respiratory rate have been increased. She has difficulty sleeping at night and is generally irritable. And she's noticed that during her 5-kilometer run, her time was longer than normal, despite all the training that she's been doing. So, could Jenny have overtraining syndrome? Sure. Could Jenny have something else, like chronic fatigue syndrome or depression? Sure. So that's where the difficulty in actually diagnosing overtraining syndrome comes in, because Jenny very well could have that and likely needs to add some more rest days or even more strict rest into her regimen. But it's difficult because she might have something else going on too. So hopefully with additional studies that are being done, it's going to make it a little easier for trainers and coaches and even athletes to be able to diagnose this potentially harmful syndrome. So in conclusion, overtraining syndrome is a somewhat uncommon but serious condition, and it can hold athletes back for quite a while, and as we mentioned, sometimes even forever. They may not be able to return to their sport. Causes are not completely understood, and it's very difficult to predict and diagnose at this time. There are ways to prevent it, which the personal fitness trainer needs to keep in mind, and once it occurs, management is strict rest. Thank you.